guys, welcome back to the channel, and today we are gonna see chapter 5, that is assessment and management of women during postnatal period. Postnatal period is nothing but after the delivery, and from this chapter you will get just only one question, and that is for 5 marks. If you read this chapter, you are ready with 5 marks. Now the very first topic is puerperium. Puerperium or normal puerperium. This is nothing but in the delivery process, women's body will be changed, fully changed. That is, abdomen will be enlarged, our breast will be increased, even our mood will be lots of swinging, and hormonal changes, psychological changes, everything. There is a lots of change in a woman during the pregnancy. And those changes will get normal after the delivery. So, after the delivery, the woman's body is coming back to the normal pre-pregnant stage, and that process is known as puerperium, and this takes place around 6 weeks. Not just in one day the woman's body will come back to normal position. It's a slow process. So since after the delivery, the next 6 weeks, whole 6 weeks, the woman's body will undergo the repairing process to come back to the normal position. So what is normal puerperium? That is, after following the normal birth or the birth of the baby, the body tissue and pelvic organs, every organs revert back. That is nothing but comes back to the normal pre-pregnancy stage, both anatomically and physiologically. That is normal puerperium. And the duration is 6 weeks. That is, the women, one who have undergone the delivery process, one who have given birth, for her it is 6 weeks, either C-section or normal delivery. But for the woman, one who have undergone the abortion process, for her it is 2 weeks. Within 2 weeks, her body will get normal. Physiological changes. In postnatal period, physiological changes can be also said like reproductive system changes, because postnatal, or that is almost related to the delivery process. That is nothing but reproductive system changes. Okay, so here first is uterus. Uterus undergoes involution of uterus. Involution of uterus is nothing but shrinkage of the uterus. Uterus will be enlarged, right? So those coming back to the normal position, that is shrinking of uterus. Let's see the weight. At the time of pregnancy, the uterus will be enlarged and its weight will be around 900 grams, that is around 1 kg. After the delivery, it will get shrunk to the weight around 60 grams. This is the normal weight. Now let's see how the changes occurs. That is, around 24 hours, around 1 day, there is no change. Okay, but from the second day to the 11th day, the fundus will start to descend. Descend in the sense it goes down. Down in the sense it starts to shrink. Per day, the uterus will shrink around 1.25 centimeter. That is, in 2 to 11 days, it will reduce around 13 centimeter. 13 centimeter. Okay. And in 11th day, from the 11th day, it will be exactly behind the symphysis. And in the second week, around second week, you will not be able to palpate the uterus. In the sense, the uterus will be in its area. It will not be perfectly in its area, but you will not be able to palpate. You can't find the uterus. It will be on its position by second week. Length. Length in the sense, this is umbilicus. Okay, this length will be expanded to 20 centimeter, but after the delivery, it will get shrink to 7.5 centimeter. Next, breadth. Breadth is this way. Breadth will be around 12 centimeter, but after the delivery, it will get shrunk to 5 centimeter. Thickness, in the sense, the uterus thickness, it will be around 7.5 centimeter, and it gets reduced to 2.5 centimeter. This all process occurs in this 2 weeks. Okay. Placental site or involution of placenta. Involution is nothing but tightening of the placental site. First of all, what is placental site? At the time of pregnancy, this placenta will be attached to the womb. That is placental site. In the time of delivery, this placenta will be removed by applying the force. So there will be an injury in the uterus layer. Okay. so that uterus layer injury will get healed in this time. That is around after delivery, around 6 weeks, this wound will be healing. It will be healed by regenerating the endometrium layer. I think you understood. And next, this is very important. When the wound occurs, when the injury occurs, you can see leukia which is formed there, that is an vaginal discharge. In this discharge, you can see there will be mix of blood and necrotic deciduals. What is decidua? Decidua is nothing but, if you see in the process of formation of baby, in uterus there will be a cilia like structures which are being grown to protect the baby and layer around the uterus, that is decidia. This decidia after the delivery will get necrotic in the sense it will get dead, and it will be removed after the delivery in the form of leukia, and it will be mixed with blood. Almost it's equal to menstruation. Okay. Vaginal discharge after giving birth, and this discharge consists blood, mucus and uterine tissues. Okay, this is leukia and it's very important. Okay, in general, how the process occurs in the sense, the superficial layer of decidia, the superficial in the sense the primary layer, the first layer of the decidia gets necrotic in the sense they will get converted into dead cells, and then they will get swiped off in the sense they will get washed off, and this is how leukia is formed. Leukia is all about 3 types. For the first 4 days, it will be in this color, that is a dark red color, and this is known as leukia rubra, and this 4 days blood consists of blood, shedded particles of fetal membrane, that is if any fetal membrane is left over in the womb, that will be swiped off, and then deciduals will be swiped off. Again, wernicke calceosa also will be swiped off, and if any kind of remaining meconium is present in the uterus, that is also swiped off in this first 4 days, and this first 4 days blood is known as leukia rubra. And next, after that, from 5 to 10 days, the release of the fluid is known as leukia serosa. And this leukia serosa is normally pinkish color. For few, it will be from brownish to yellowish color, in that dim color. And this consists of leukocytes. If any deciduous, that is necrotic deciduous, everything will be swiped off. And next, the last, that is from 10 to 14 days, this is known as leukia alba, and this is the third stage, and after 14 days it will be completely stopped, the discharge will be stopped. And this leukia alba is in whitish yellowish color, and this is the last thing that is swiping out from the uterus, that is the leukocytes. If any mucus is present in the uterus, everything will be swiped off. After this, the uterus will be completely alright. There is no any remaining particles. The smell of the leukia is fishy in the smell, and the nature is alkaline. It is not in acidic in nature, and the amount that will be released, that is after the delivery, 250 ml of blood will be released in the form of leukia. Cervix will be flappy, loose, thin and structured because of the delivery process. And you can see there are few small tears that will be observed, and even bleeding can be seen. That's common. How it will be get cured? That is, for the first 1 week after the delivery, the cervix will be opened wider, and it will be staying wider for 1 week. That is 2 to 3 fingers you can insert inside it. By the end of the second week, that is 14th day, it will be reduced to 1 centimeter. And by the end of 6th week, it will be back to normal. Back to normal in the sense before pregnancy stage. But one thing to remember, parox cervix can never be non-parox cervix, in the sense the cervix which is present before the delivery can never be achieved after the delivery. Okay. Vagina is poorly toned, and the vascularity and edemas can be seen. Vascularity in the sense the veins will be visible, and edema is also quite common, and this both will be reduced by the 4th week. By the 6th or 10th week, the vagina will be back to normal. But one thing, after delivery, the vaginal size will be increased a bit larger than the first. Okay. Menstruation and ovulation. For non-lactating women, it will be returned by the 6th week. In the sense, after the birth of the baby, if the baby is dead, or it is an abortion process, then the woman will definitely not breastfeed her baby. So that is a non-lactating woman. So for her, it will be returned, that is menstruation will be returned by the end of 6th week. For lactating women, she will get her menses in between 2nd month to 8th month. For some, even it takes 9 months to get their menstruation back. Perineum. Perineum, it is the place, that is, it is a layer between the vagina and the anus. In between there is a place, no, that is perineum. And in this place you can see episiotomy, it is performed. So generally in this area, it will be edematous or erythematous or uncomfortable is common. Okay. Edematous in the sense it will get swollen. Erythematous in the sense, there will be a scar. Red blood cells will be formed in the fiber forms, that is erythematous, and generally uncomfortable and pain is common in this area. In breast, you can see the first thing is colostrum. Colostrum is the first milk that is produced in the woman, and it will be secreted for first few days, and then day by day the production of prolactin hormone in our body will be increased. It indicates the milk production will also be increasing, and it indicates physiologically there will be an engorgement. Engorgement in the sense the breast will get enlarged, it will increase in size. These are the changes or physical adaptation that is seen. General changes, other physiological changes of postnatal period. In this first one, the pulse at the time of delivery it will increase vigorously, and after 3 days it will come back normal. But until 3 days it will be increasing, decreasing, increasing, decreasing. For few days it will be unstable. Okay. Next, temperature. At the time of delivery it will increase, but within 1 day, that is within 24 hours, it will get back to the normal temperature. And BP, with the temperature, the BP also comes to stable. At the time of delivery, the BP also will increase, but within 1 day, within around 24 hours, the BP will come to the normal level, that is 120 by 80 mmHg. Urinary tract. In urinary tract, diuresis is common, in the sense increased amount of urination and frequency of urination is also seen. And lacturia, in the sense urine consists of large amount of glucose in it, and these symptoms will last for 2 to 3 days, and after this the symptoms will be reduced. But one thing to remember, renal pelvic, that is the urinary bladder, will never stay in its position, because due to the pregnancy process the urinary bladder will be suppressed and it will be pushed downwards. So to become normal, to come to its normal position, it takes 8 weeks. Okay. Next, gastrointestinal tract, GI tract. And because of this excessive process, that is because of this delivery process, there will be lot of fluid loss and increase in thirst. Because of fluid loss, the constipation also occurs. Dehydration is very common in this condition. Weight loss. At the time of delivery, 4 kgs will be lost in the form of fetus, that is baby, placenta and amniotic fluid. Altogether, it counts 4 kg. At the time of delivery, the woman loses 4 kg, and after delivery, she loses 3 kgs in the form of puerperium stage. In puerperium stage, recovering stage, at that time there will be blood loss also seen in the form of leukemia. So at this time, she will lose 3 kgs. And next, blood. Blood will be lost excessively. So there is a decrease in blood volume, and this volume automatically starts to regain by the end of 2nd week. Okay. If she is unable to regain that, we need to provide her supplements. Cardiac output. At the time of labor, cardiac output will increase vigorously, that almost 60% of her heartbeat will be increased than the normal. Even for some patients, at the end of 3rd day, it will never come to the normal condition. It takes 4 to 5 days for some patients to get the normal cardiac output. Respiratory system will not have any changes. If they have any changes, if the patient has any respiratory problem, then oxygen will be provided at that moment. Musculoskeletal system. In this, pain and discomfort is very common because of the push technique. That is, at the time of delivery, the mother will be pushing the baby towards downwards. So because of that, the mother may feel fatigue, and she has arm ache, shoulder ache and muscles ache definitely, and abdomen muscles will lose its tone and will regain around 6th week. Joint pain, mainly pelvic pain, and all these symptoms will be cured by 6th to 8th week. For generally it's in written wise, like in theoretical wise, it is 6 to 8 weeks. For in real life, it takes almost 2 months for a woman to come out of it. Immunological system, in this, because of dehydration and blood loss, the patient will have chills and pain. So chills indicates fever, okay. Because of this, she may get fever, or because of PROM, that is premature rupture of membrane. Because of this also, the patient's temperature will be stayed high, it will never get reduced. And because of another condition is breast engorgement, that is breast increasing, because after the delivery the woman is about to feed the baby. Because of that, prolactin hormone is produced. Because of that hormone, her breast is engorged. Because of this action, she will have low grade fever. So there are 3 conditions by which the patient has a chance of getting the fever. So we need to take care of her. These are the general changes which is seen in the postnatal period. Physiology of lactation. First of all, what is lactation? Lactation is nothing but milk secretion, the production of milk in the female breast. And the first milk which is produced is known as colostrum. That colostrum is rich in fatty acids, proteins, minerals and immunity energy. Okay. First milk is colostrum, and then after 2-3 days the normal milk is produced. How the process? Let's see it. First is mammogenesis. Mammogenesis is nothing but the preparation of the breast. Before producing the milk, the breast should get prepared and grown well. So in this mammogenesis, in this process, the both ductal and lobula alveolar are developed, and this is developed with the help of estrogen and progesterone hormone. It is mainly released from the placenta. That is mammogenesis. This is the first step. Mammogenesis is nothing but preparing the breast for the production of milk. And the second is lactogenesis. Lactogenesis is nothing but synthesizing and secretion of breast alveoli. There is nothing but the production of milk. For producing the milk, we need prolactin, and this prolactin hormone is present throughout the process of pregnancy. That is, when the women get pregnant, since then the prolactin starts to develop in the woman. This prolactin produces the milk. The question is, from the beginning of pregnancy, the prolactin is present in our body, but why not the milk is produced? It is because of the estrogen and progesterone levels are very high in our body. They suppress the work of prolactin in our body. Because of this estrogen and progesterone, the prolactin work is not shown out. But at the end of the delivery, the progesterone and estrogen level is falling down, which indicates the prolactin can work now. In the sense, the prolactin hormone is producing the milk at the end of the delivery. Okay, it's a very important point. Next, galactokinesis. Galactokinesis is nothing but ejection and removal of milk. In the sense, first the breast is getting prepared and then the milk is synthesized. Now the milk should be ejected, and this ejection is done in the form of milk ejection reflex. I will repeat now, you can note down. Milk ejection is done. First, the baby sucks the mother's nipple. The mother's nipple sends an impulsion to the mother's pituitary gland. That pituitary gland releases oxytocin, and that oxytocin relaxes the alveoli, and alveoli releases the milk. This is the milk ejection reflex. And next, galactopiosis. That is nothing but maintenance of lactation. Just once the milk is produced and then the milk is over, it is not the correct one. We need to maintain the lactation, right? So galactopiosis is nothing but maintenance of lactation, in the sense maintenance of prolactin hormone, producing more prolactin hormone. Okay, this is the physiology of lactation, and written notes will be available after this. The milk is produced in us is actually calculated in this formula. 60 into number of days, that is postpartum, after the delivery, how many days. For example, if mother has given birth and it is 4th day, okay, she has been gave birth on January 1 and now it is January 4, and today if you see, the mother's milk that is produced is 240 ml. 60 into 4 is equals to 240 ml of milk is produced today, and tomorrow, that is 5th day, 300 ml of milk will be produced. It will be increasing gradually, but by the end of 2nd week, that is 14th day, it will come back to 120 to 180 ml of milk by the end of 2nd week, that is 14th day. Okay. Suppression of lactation. Suppression of lactation is nothing but stopping the production of milk. This condition is followed when the baby is born dead, that is after the delivery if the baby is dead, or mother is not willing to give breastfeeding, and the breastfeeding is contraindicated in the sense if the mother is having any immunological disorders or like AIDS, then the mother is advised to stop the breastfeeding. In this condition, the suppression lactation, that is stopping the production of milk, is done, and the drugs that are provided to stop the lactation is bromocriptine, or in the simple words, Parodil. 2.5 mg it is provided orally morning and night, that is twice a day for 2 weeks continuously, and it stops the production of milk. And it also helps the return of ovulation. When the prolactin hormone is decreased, then automatically estrogen hormone and progesterone hormone is increased. Okay, so automatically ovulation will occur. Next, if this is not possible, then we will give ethylene estradiol 0.05 mg, and it is provided morning and night for 5 days. And there is another comboed treatment, that is combination of estrogen and testosterone prepared mexogen, and this injection is given IM after the delivery. Remember, this process is done to stop the production of milk. It is not done for every mother, and there are some other followings also followed, that is for mother we need to advise to stop the breastfeeding if the baby is alive, and even to not pump or excrete the milk from the breast, because after providing these drugs, suddenly the milk never stops to produce. It will take time, no? So we, even at that time, even the milk is produced, she is not allowed to pump it. Okay. Next, a tight compressed band around her chest, it is rolled. Around her chest, a tight band is covered, and it is for 2 to 3 days. And analgesic tablets are provided to get reliever from pain. This is suppressive of lactation, and do add your answer with your nursing care. Postpartum exercise, that is after the delivery you need to do few exercises to regain the muscle tone, to regain the strength in the muscles, and to get back the organs to the proper position. The first exercise is deep breathing. You have to advise the patient have to sit straightly and breathe deeply and slowly from the abdomen, mainly in the diaphragm. But mainly you advise the patient to breathe from the abdomen slowly and deeply, and repeat it to 5 to 10 times. And the second exercise is head and shoulder raising. The mother is advised to sleep straightly and do crunches. Crunches in the sense just lifting the head and touching her chest with the help of hands. Okay, you know how the crunches are performed in that way, but you have to sleep straightly. And this is advised to perform for 10 times. If possible, she can perform for 20 times. That's a good exercise. And next, leg rising. Leg rising in the sense the mother have to sleep straightly and lift either one leg or 2 legs at a time. She had to raise the leg by inhaling and down by exhaling. This is leg raise exercise. This can be performed for 5 to 10 times. Next, pelvic tilt. This is nothing but the mother is advised to sleep like this, that is by bending her knees, and then by inhaling she have to lift her abdomen by bending her knee. This is her knee. By inhaling she is sleeping like this by bending her knees. By inhaling she have to lift her lower abdomen, and this is pelvic tilt, and this helps to strengthen the pelvic region. And next, sit-ups. Sit-ups is nothing but sitting and get-upping up. This can be performed in one day, actually 2 to 3 times in random time. It helps the pelvic organ to get into their original position. These are the postpartum exercises. Management of the discomforts in the puerperium period. Okay, at this time the main thing that is seen is after pain. After pain in the sense the pain after the delivery, and this pain is so vigorous in first 2 to 4 days. Okay, it is because at this time the contraction relaxation of uterus is constantly seen, and there will be a cut and blood clots also seen because of the delivery process. Because of those things, the pain is so vigorous in first 2 to 4 days. Even if you provide the medicine, still the pain can be seen. To get relief from this, we need to advise the patient to stay empty bladder. She need to empty her bladder whenever she feels full. Because of this, her pelvic will feel a bit relief, and after emptying her bladder, she need to place the pillow under the abdomen. Because of this, the contraction pressure will be reduced. And after this, if possible, she can massage her uterus. This is also helpful. And for the clothing factors, we will administrate ergometrin, and analgesic is also given to reduce the pain. These are the things that is followed to reduce the pain. That is, first we need to advise the patient to go empty bladder and place the pillow below her abdomen. If possible, provide massage for the uterus and administrate ergometrin and analgesic. Next, perineal pain. Perineal is nothing but perineal area, the area between vagina and anal. At this area, there will be a normal pain, and if episiotomy is provided, then she will have more pain. Infection is very common in this area. To reduce the swelling, numbness, we will provide the cold application. The cold application is provided by filling the ice in the rubber gloves, or ice bags is given for the patient, and she will place this ice bag in the perineal area. And Swiss bath is also very beneficial. And tropically ointments, that is anesthetic sprays or ointments, is given to apply over the perineal area to reduce the pain. But the most effective one is cold application. Next, constipation. Because of dehydration, the constipation is seen. For that, they will provide medicine, but mostly for many patients, they don't provide medicines. It is naturally curable. Apart from this, if the patient is having any other condition, like she has any breathing difficulties, you need to provide her oxygen, that is, you need to place her in ventilation. And if she has any other like abdomen pain or anything, you need to inform the doctor and follow those applications and follow those medications. Okay, with this you need to add nursing care to complete your answer.
These are the questions from Unit 5. Practice well. Meet you in the next video. Until then, stay tuned. Bye.